Now, we've been hearing about the recent outbreak of mumps hitting our area, so how do you know if you're at risk, or even worse, if you already have it?
Right, well, here to educate us on the subject is Dr. David Greuner. He's the managing director and co-founder of NYC Surgical Associates. So welcome, thank you for being here this morning. Okay, so what exactly is mumps? We're hearing about it just as of late.
Mumps, like many things, is a viral illness. Like most viral illnesses, it's self-limited, but it's also very, very easy to catch. And we don't really hear much about it because most people in America undergo immunization. It's part of the American Academy of Pediatrics recommendations. So when you do hear about it, it's usually in very congested areas like army areas or
universities.
In colleges.
Yeah. What are the symptoms?
So, like most viral illnesses, it affects vast varieties of the body. So viruses don't really affect one organ system. Your body, viruses hijack your body's cells. So one of the ways your body gets rid of viruses is by doing things that can kind of clear itself entirely of the virus. So you will experience just global signs like soreness, just overall feeling. Fever.
Headache. But is this a headache that's a little bit more than what you've experienced before, or
it is
it just a combination of all the symptoms together?
It's a combination, but later on in the disease of mumps, you kind of get more typical symptoms, and the symptoms that you would get are pancreatitis, so abdominal pain, vomiting, very severe stomach pain, and also males can get what's called orchitis, or swelling of the testicles, and you can also get
Fantastic.
Look out for that.
Yes.
No, definitely. Well, what should you do if you have the symptoms?
If you have the symptoms that feel like you have the mumps, you should go seek medical attention, but you should know that there's no very discreet treatment for it. Treatment is mostly self-limited and symptomatic in nature.
Now, this normally affects kids, so pediatricians would deal with it, but now we're dealing with college kids, right?
It does, and this is probably, you should understand that immunity, although it's very effective, doesn't confer 100% immunity. So immunity is effective till the end of your life, but it's effective only to the strains that the vaccine affects. So about 80% immunity is conferred from the vaccination.
Yeah, but we've heard that it's been spreading at Fordham, so how do they contain it?
Well, what's happened is you probably had a strain that was resistant to the vaccine in a congested area, so that strain kind of amplified in that little area.
So you've already talked about some of the statistics of it as far as the MMR and the 80%, but what are some other risks, and how else can it be spread?
So the main population at risk is women in their first trimester of pregnancy, which mumps could cause a spontaneous abortion for.
Wow.
Men with testicles, which is the vast majority.
Yeah, well.
Right there.
And people that are already prone to pancreatitis, so people with a heavy drinking history and things like that.
Oh my gosh. So are there any preventative measures that we can take?
Not really. If you see anyone that's sick, obviously stay away. So basically the same way that you would try and contain meningitis or viral meningitis, which is a similar type of disease. And mumps can also cause viral meningitis. But if you have someone sick, you should kind of contain them, quarantine them, and keep them away from other people or large populations of people.
For how long? What's the timeline of this disease?
Believe it or not, mumps is actually contagious 2 days before the onset of symptoms.
Great.
So how do you know? Yeah.
You don't.
Oh, wow.
And for 2 weeks afterwards.
So why do you think this is happening right now? Why do you think there's this outbreak?
Just because it's a small area and there's a resistant strain, probably.
Well, you're just really cheering us up this morning,
Doc. Thanks a lot, Dr. Greuner.
I feel great as a guy. Wow.
Well, no, great information for us to share with everyone. We really appreciate you being here, Dr. David Greuner, and you always help us stay healthy on the couch, so thank you.
Thank you very much.
All right.